Hi, this is Dr. Nandini Nelivigi, a senior consultant orthodontist, Director Nelivigi Dental Clinic, Bellandur, Bangalore. Today we will talk about a very interesting topic, avulsed tooth. When you have a trauma and the tooth completely comes out of its socket, it is called an avulsion. Now when a tooth gets avulsed, what to do is a very important thing that one has to know. The best thing that somebody can do with an avulsed tooth is put it black or place it black in its socket. But it's easier said than done. Many times there can be situations like one, the trauma can be so intense or a severe trauma that other parts of your body require more attention than an avulsed tooth. 2. It can so happen that the tooth has fallen into a dirty area and you find it difficult to put it back into your mouth. 3. The tooth is there but you do not know how to place it back into the socket. 4. The pain is so intense that placing the tooth back into its socket might be a difficult task to do. Or 5. You really do not know what to do at all. So in these situations, when somebody is there, they have to first know what to do in an emergency situation like this. First thing, please do not panic. It is a tooth. We can always find some way of replacing a missing tooth. So you do not have to worry. Do not panic at all. Second, if possible, lightly rinse the tooth in plain water. Do not scrub it to remove whatever is there on the tooth. Just lightly rinse it in regular water. If you can put the tooth under your tongue and reach the dentist, that would be the best thing. If not, put it in a glass of milk. If even that is not available, you can just put it in a glass of plain water and reach the dentist at the earliest. Approximately about an hour's time is a good time for the tooth to be re-implanted. The longer the duration of the time that the tooth is outside the mouth, the less is the prognosis of how well the tooth will be taken up by the body. The reason why you are keeping it under the tongue or keeping it in a glass of milk or water is because you don't want the tooth to dry up or dehydrate. So don't dry up the tooth, let it be moist. Now when you reach the dentist, what does the dentist do? First, inspect the tooth as to what has happened. If root canal treatment has to be done, it can be even done outside the patient's mouth. It need not be replaced before it. So the dentist will probably do a root canal also. He will clean the root surface with saline, probably by rinsing it with a flush of saline or something like that, but not scrub it to remove the periodontal ligament space. Give a local anesthesia injection to the patient so that the pain is avoided. Inspect the tissues around. If the cortical plates or the bone is doing good, the tooth will be placed back in its socket. It has to be pressed hard so that it reaches the right position, and then the teeth will be splinted together. The splint may stay for about 2 to 3 weeks or maybe even up to 4 to 6 weeks if need be. And if everything is good, the tooth is taken up by the body. Then you can later on get a replacement crown made. Sometimes after the tooth is replaced, there are two things that can happen. One is that the root undergoes resorption because of the tooth being out, it is being handled outside the mouth and then it is being replaced. Or second thing that can happen is that the tooth gets ankylosed to the bone. In these two situations, again we have to see what next can be done and accordingly treat. So the main thing that a person has to do is 1. Do not panic. 2. Rinse the mouth in just plain regular water. Keep it under the tongue or put it in a glass of milk or water and reach the dentist at the earliest that you can. Please do not panic. We can always find a replacement of our tooth in any situation. Thank you so much. Hope this helps.